Good afternoon. This video is a makeup video for the classes that were missed on Thursday because of the day off on the 1st of May. I'll be starting at diagnosis of multiple sclerosis or MS, and I'm sorry for the noise because I'm recording at school. I'll not be covering the symptoms and signs of MS because they have already been covered when we were taught while you read the paragraph on multiple sclerosis in the homework. So I'll be starting by the diagnosis. How can we diagnose a case of multiple sclerosis? Of course, as you know, multiple sclerosis affects mainly the central nervous system. And you also know that the central nervous system, including the brain and the spinal cord, are surrounded by a fluid. That fluid is mainly protective to the brain and to the spinal cord. And as we said before, that fluid that surrounds the brain and the spinal cord is present in the spaces of the arachnoid mater. We have dura mater, pia mater, and arachnoid mater. And by mater here, we mean the mother and not mater. It's only one T. And this fluid is called the cerebrospinal fluid. So CSF stands for cerebrospinal fluid. That cerebrospinal fluid is all the time circulating around the brain and the spinal cord. There is fluid that is added, fluid that is removed because it is connected with the veins. We're not going to cover the details of cerebrospinal fluid here, but we can say that the cerebrospinal fluid is important for diagnosis of neurological diseases because the cerebrospinal fluid has a certain concentration of glucose, a certain level of white blood cells, and so on. And if there is every variation in these criteria can give you an indication of inflammation, for example, or an autoimmune disease. So in such a case, what we would do is a lumbar puncture. And a lumbar puncture means that in the lumbar region of the spinal cord, we're going to introduce a needle, a wide bore needle under aseptic conditions. Of course, it should be under complete aseptic conditions. And we are going to draw some of the fluid, a small volume of fluid from the cerebrospinal fluid that circulates around the brain and the spinal cord, and we're going to analyze it. There is the routine analysis that we do, like the white blood cell count, the glucose count, the electrolyte level, and so on. But there are also specific investigations that we do whenever there is suspicion of an autoimmune disease, like, for example, that we assess the level of antibodies associated with multiple sclerosis, like antibodies against the myelin sheath, for example. Of course, we don't do this as a routine, but if you are suspicious of MS or multiple sclerosis, then you are supposed to assess the antibodies related to MS in the cerebrospinal fluid. Furthermore, you can confirm or rule out infections of the spinal cord or of the brain because there are certain infections that might give similar symptoms to multiple sclerosis. And we don't want to go deeply into those details in order not to lengthen the video as well as the content of the curriculum as a whole, but it is important to rule out infection. So if you don't find the signs of infection, when you diagnose the cerebrospinal fluid, then and you find the antibodies, then it is definitely an autoimmune disease. And if you find the antibodies against multiple sclerosis, then it is definitely multiple sclerosis. You can confirm this by doing MRI, and the MRI stands for magnetic resonance imaging. Magnetic resonance images is a very useful tool of imaging, especially of the brain, and magnetic resonance imaging can detect a wide array or a vast domain of neurological diseases affecting the brain and the spinal cord. And it's not a CT scan. In the CT scan, CT stands for computerized tomography. CT stands for computerized tomography. And tomography means dividing into layers. So if you look at the film of computerized tomography or CT scan, you will find that the pictures you are taking of the brain are pictures of slices, very thin slices of the brain. Magnetic resonance imaging, in many cases, many neurological cases, magnetic resonance imaging is useful in diagnosis, and it is preferred to CT scan because it does not, CT scan exposes you to a very high dose, a very high dose of X-ray. And of course, in people who are genetically predisposed to cancer, this might be on the long run predisposing to cancer, especially if you do it frequently. So you have to be very careful when you decide to have a CT scan done. But magnetic resonance imaging does not expose you to this high dose of X-ray, but there is a small concern about magnetic resonance imaging. And this concern is that the imaging process includes exposure to a magnetic field. And therefore, there are certain contraindications. First of all, of course, you shouldn't be wearing any metallic jewelry, for example, like earrings, like whatever, necklaces, and so on, because they are affected by the magnetic field. But more seriously, if you have especially in the vertebral column, if you have, for example, a plate and screws. A plate and screws are made of metal. It's true that it is a non-reactive metal, but it is a metal after all. So it can be like attracted to the magnetic field. And therefore, if you are using the plate and screws to fix two bony parts in space, then if they are attracted to the magnetic field, or if they are affected and moved by the magnetic field, then this fixation might be damaged. Of course, we usually say that after 6 months, if you have a surgery done to fix two bony ends, for example, by if you have two bony ends and we are fixing them by a plate and screws, then after 6 months, it is said that it's usually safe to be exposed to the magnetic field of MRI, but of course, we should be on the safe side. So if it's not really needed for diagnosis, then you should also avoid magnetic resonance imaging. The other concern about magnetic resonance imaging, but it's also a concern about CT scan, is that you can use an intravenous injection of a contrast material. The contrast material is like a dye that helps you visualize more the blood vessels, the ventricles, or the areas of the brain that contain inside the substance of the brain. There are certain areas called the ventricles, for example, like this, spaces that contain cerebrospinal fluid, and they are called ventricles. Of course, they are very different from the ventricles in the heart, but you can visualize more the blood vessels and all the hollow structures that might receive the dye. But of course, there is a great concern about the intravenous injections of contrast materials. They have a benefit. They help you visualize more. They help you visualize better the structures in the brain. But the main concern about them is that they might cause severe allergy. And unfortunately, this allergy is usually in the form of what we call an anaphylactic shock, which is a shock due to allergy. And this anaphylactic shock is usually accompanied by a severe drop in blood pressure, to the extent that the brain might not receive enough oxygen for a while, and the patient might suffer. I've seen these cases, patients suffering from hemiplegia, for example, after these dies because of the severe allergic reaction that is called the anaphylactic shock. This was the diagnosis of multiple sclerosis. What about the treatment of multiple sclerosis? Of course, there is no definite cure or definitive cure for multiple sclerosis, just like all autoimmune diseases do not have cure, but you can diminish the symptoms and signs, the crippling symptoms and signs. You might speed up relief and recovery. And when we say recovery, we mean recovery from the present attack, not recovery forever. And you can also, in addition to speeding the recovery, you can modify the course of the disease. Modify the course of the disease means that the disease will still be there, but for example, the symptoms modifying the course means that we will have milder symptoms, we will have longer remissions. Remissions means that the disease is diminishing in intensity, and shorter exacerbations. And an exacerbation is when the symptoms are more serious and stronger, more intense or aggravated, as well as less frequent attacks, which we can express in the form of fewer relapses. A relapse is when the disease recurs. Recurrence of a disease is called relapse. And you know, from last year when we were talking about glomerulonephritis as an autoimmune disease, that all autoimmune diseases are characterized by remissions and exacerbations. Remissions when the symptoms are milder, and exacerbations when the symptoms are more severe. And one of the major and very frequently utilized medications used in case of multiple sclerosis are the corticosteroids. And the corticosteroids are mainly prescribed to reduce the autoimmune inflammation that occurs. And if you prevent or diminish, you cannot prevent altogether, but if you diminish the amount of inflammation, then you will definitely diminish the extent of demyelination. So it's important to diminish inflammation, because diminishing inflammation means diminishing the severity of demyelination. But of course, as you know, cortisone raises the blood pressure, raises the blood glucose level, and therefore it might be contraindicated in case of people who are hypertensive, having elevated blood pressure, or people who are diabetic, having elevated blood glucose. Furthermore, increased levels of cortisone might result in sleep disturbances to the extent that the patient might be unable to sleep, insomnia, and mood swings, mainly depression, by the way. People who take cortisone for a long period of time are usually depressed, in addition, of course, to the very severe symptom of fluid retention. Cortisone causes salt retention, and therefore, of course, water retention, because you know that water will pass by osmosis to areas that have a high salt concentration. So the patient would suffer from edema of the lower limb and even edema of the hands or swelling and accumulation of fluid in these parts of the body, which makes the movement more difficult. The patient already suffers from difficulty in movement, and this accumulation of fluid would make it more and more difficult. Depression, of course, will exacerbate the symptoms, will increase the symptoms, because when we said that the disease and autoimmune diseases in general are characterized by remissions and exacerbations, we should know that flaring up or exacerbation means flaring up. Flaring up is more about spreading more in the body of the clinical picture. Exacerbations usually occur under stressful conditions. That's why it is very important that people around a patient with MS should be very careful and should treat him nicely and take care of them. Another important, rather recent way of treatment is plasmapheresis. Plasmapheresis means that you take a sample of blood from the veins of the patient. You take a sample of blood. And blood, of course, is plasma and blood cells. And then you remove the plasma and you separate it from, you separate the plasma from the blood cells. And then instead of returning the RBCs or the blood cells in general to the plasma, you mix those blood cells with albumin instead of serum, and then you return them to the body. So it's just like you exchanged the plasma of the patient that might contain antibodies. You substituted for albumin, which does not contain antibodies. And plasma exchange or plasmapheresis is really useful whenever the patient is irresponsive to steroids. There are, of course, other medications that are called disease-modifying drugs, and the disease-modifying drugs are considered immunomodulators, meaning that they modify the course of the disease, and they do not have the same side effects of cortisone, but they have their own side effects, of course, and not all patients with MS tolerate the immunomodulators. And the DMDs or the immunomodulators will, as you know, stimulate the immune system if it's too weak and diminish the activity of the immune system if it is too high. Another neurological disease is Alzheimer's disease. And of course, you know that Alzheimer's disease is a progressive neurological disease, meaning that at the beginning, the symptoms are mild, and then it starts progressing and increasing until we end up by dementia. So Alzheimer's disease is one of the causes of dementia, and dementia is a decline in everything, in all the mental activities. It is a decline in thinking, meaning it is a decline in cognition, in the cognitive skills and powers of the brain. Of course, if your cognitive skills, if your attention, your logical thinking is affected, definitely there will be, and of course your memory, it's not only about cognitive, about thinking, but it's in cognitive skills include thinking, but they also include memory. So it's not only about this, but this will be reflected on behavior, because if you, for example, go to the kitchen and see the kettle, see the mugs, and see the jar that contains Nescafe or milk or whatever, you will not, if you lost memory of these habitual acts, then you might be unable to do things that you were previously able to do. And you might also even forget how you used to behave in certain conditions. For example, you used to control your temper, for example. This is a behavioral response. So if you have a memory loss and a cognitive decline, then you will forget how to react in such conditions, and you might react in a very instinctive manner and lose your temper, for example. So gradually, the patient will be dependent on other people because family members and close relatives will realize that it's risky to leave the patient alone and that the patient feels lost. So, for example, a person might stand up in the middle of the kitchen or in the middle of the bedroom, not knowing what to do, what the next step is. The main pathology that results in Alzheimer's disease is the deposition of abnormal proteins in the brain, inside the brain cells and outside the brain cells, inside the neurons and outside the neurons. One of the proteins that build up is called the tau protein. And those proteins that deposit around the brain cells form what we call the plaque. They are extra neuronal plaques. And both the tau protein and the extra neuronal plaques affect nerve transmission. So instead of having a normal rate of transmission of the nerve impulse, there will be a slower rate of transmission of a nerve impulse. So if a certain calculation like 4 plus 8 divided by 2, you used to do this in a fraction of a second, then you will do it in a in a much slower way, and you will take a longer period of time to do this just because there is impaired nerve transmission. These tau proteins inside the neuron form like clusters or tangles inside the neuron. And as I said, they block the neuronal transport system. Not only this, so we have several problems with the neuron. We have the plaques outside the neuron that inhibit or diminish the transfer of impulses outside the neuron. We have the tau proteins that form like tangles inside the neuron and that also inhibit transmission, because in order for the nerve impulse to be transmitted adequately along the neuron, this occurs due to electrolyte changes in sodium and potassium, both outside the neuron and inside the neuron, and both are correlated. So if any one of these outside the neuron or inside the neuron, these electrolyte exchanges is affected, then definitely there will be a problem with neuronal transmission and with synaptic transmission again, and therefore all brain processes will be slowed. Why synaptic transmission? Because the plaques do not only, these plaques that we call amyloid plaques, it's like a carbohydrate material, I think, I'll check. The amyloid plaques do not only form around the neuron, but they also form in the synapses. So they block the synaptic transmission. Oh, actually, sorry, they are protein fragments. Yes, the amyloid plaques, I'm sorry, they are protein fragments that accumulate between the synapses. And why are they accumulating? It's like when you get older and you have the free radicals that result from oxidation in the cell that build up. Why are they building up? Because at a younger age, those accumulated free radicals, the body can get rid of, and the rate of their formation is equal to or less than the rate of their removal. But similarly, in case of the plaques, they're all the time forming, even in younger individuals, even in individuals that do not have Alzheimer's disease. But the fact that if you have Alzheimer's disease, then the rate of building up of these tau proteins and these amyloid plaques inside the neuron and outside the neuron and in the synapse will be more than the rate of getting rid of them. So gradually what happens is that the neurons will die because of the tangles inside them and because of the amyloid plaques outside them. and gradually there is a shrinking in the brain. You have to notice that gradually with age, after the age of 40, there is a gradual diminution in the brain size. This is a normal aging process, but this doesn't mean that you have Alzheimer. And that's why in the reports, they write there is a diminution in the brain size that is proportionate with age or proportionate to the age, which means that it is the normal diminution, but it does not necessarily impact cognitive functions. It will impact cognitive functions when it is really significant and severe. Of course, there will be memory loss, there will be confusion because of the slow cerebration. There is slow cerebration. Everything occurs slowly before the neurons get completely damaged, where there will be loss of cognitive functions and the patient will, cognitive functions, and the patient will remember only very few items in life, especially the old memories. Of course, the patient will be unable to learn new things. There will be difficulty with language because you have to remember words in order to speak. And of course, there will be, as I said before, there will be difficulty in calculations. There will be difficulty in logical thinking, which requires a complicated network of neurons that works at a significant speed. Of course, the attention span will be very shortened, but these symptoms are early symptoms. Diminished ability to work with numbers, the logic seems a bit deteriorated, the attention span is a bit shorter, we cannot cope with new situations. This is very important. I have a relative of mine, as I told you before, who has Alzheimer. It's a mild case of Alzheimer, but she can cope with old situations. When you talk to her about old memories and old situations, she can give you a good a comment about them. But new situations, it's difficult for her to answer questions about, for example, how to manage a certain context or a certain situation. Usually the patients are above 65 and older, but sometimes they might be affected at an earlier stage if they have a genetic predisposition and if they are exposed to stressful events or if they lead an unhealthy lifestyle. After the age of 65, the risk will be doubled every 5 years. So if the risk, for example, at the age of 65 is 2% of the population or 2%, then after at the age of 70, it would be 20%. At the age of 75, it would be 40%. But actually, at the age of 85, the risk of getting Alzheimer's disease is about 33%. I mean, 33% of the population. Of course, we can diminish or delay the incidence of Alzheimer's disease by diminishing all the predisposing factors like smoking, like alcohol, by eating healthy, by exercising, and of course, by socializing. That's why it is important to talk to elderly people and not to leave them alone. If you have grandparents, one or both of them, or an old neighbor, you have to check on him, talk to him, remind him of the old memories, all this kind of socialization. The patient himself, before having more severe symptoms of Alzheimer's, should read a lot, should not be dissociated from real life, should read books, should play chess, and anything that requires logical thinking. Thank you, guys, and see you on Tuesday at school, of course. Bye.